Okay, so Mark's going to demonstrate the technique for manual and muscle testing the hip flexors. The patient's position would be short sitting.
Can I see you raise your knee towards the ceiling?
He's going to check for a 3 first. If the patient did not appear to have full range, he would check that passively.
Seems to be full range.
So once you've assessed that they're at least a 3, then the stabilizing hand is at the pelvis. The resisting hand is going to be at the distal end of the femur, which is at the knee. And you're going to assess the amount of resistance the patient is able to hold against. If the patient is unable to move against gravity and you want to move them to a gravity eliminated position, that test position is sideline. And you would support that top leg while asking the patient to move through hip flexion in that gravity eliminated position. Full range would be a 2, less than full range would be a 2-. Okay, so Leslie's going to demonstrate the manual muscle test for the hip extensors, specifically the hamstring groups. So first you were going to test for a 3 by having the patient in prone, asking them to extend through their full range. Once you've assessed that they're at least a 3, then the stabilizing hand is at the pelvis, and the resistance will be at the distal end of the femur, which is at the back of the knee, at half range.
Really?
Yeah. Okay, if you wanted to isolate that test to the biceps femoris, then the position and the hand placement would be the same, but you would ask the patient to toe out during that movement and lift up about halfway and apply resistance. And to isolate the test to the semitendinosus and membranosus, the patient would toe in and extend the hip about half range to resist the movement. If the patient was too weak to move against gravity and needed to be in a gravity eliminated position, that would be sideline. And the examiner would support the top leg while asking the patient to move through extension in that gravity eliminated position to test to see if they were a 2, which would be full range, or a 2-, which would be partial range. Alicia's going to demonstrate the manual muscle test for the hip abductors. So the patient's positioned in supine to be gravity resisted. And then you're going to test for a 3 first. So abducting through full range and sideline would be equivalent to a 3. To test to see if they're better than a 3, you're going to stabilize at the pelvis. And after he moves through about half range, you're going to give resistance at the knee to assess how much stronger than a 3 he is. For the patient that is weaker than a 3 that needs to be gravity eliminated, that test position is supine. And for a 2, he would be able to abduct the hip in supine through full range. Partial range in supine would be a 2-. Brandy's going to demonstrate the manual muscle test for the hip adductors. That test position is also sideline with the top leg supported. For a 3, you're going to ask the patient to adduct their bottom leg through their full available range. To assess for grades higher than a 3, you're going to again ask them to adduct about halfway and apply resistance at the knee, and then assess how much resistance they were able to push against. The gravity eliminated position for that test is supine. And you may have to move the other leg out of the way, but adducting through full range in supine would be equivalent to a 2. 10's going to demonstrate the manual muscle test for the hip internal and external rotators. So to muscle test the hip external rotators, you're first going to ask the patient to move into that position in short sitting to test for a 3. Good. Once you're sure that they have full range and they're at least a 3, then your resisting hand is going to go in the medial malleolus, your stabilizing hand at the lateral knee at about half range. So let him move about halfway through his range and then apply resistance isometrically to see what grade higher than a 3 he is. For internal rotation, you're going to again ask the patient to move through that range in short sitting. You're going to watch the movement of the pelvis and not let them substitute with trunk movement. And then at about half range, your resistance will be at the lateral malleolus and your stabilizing hand at the medial knee to apply that resisting force. The gravity eliminated position for this test is in supine. And just the ability with the legs extended to move through full external rotation and internal rotation would be equivalent to a 2 for that test.